Hi there, I'm Dr. Matt Davis, a primary care pediatrician and the director of the C.S. Mott Children's Hospital National Poll on Children's Health. This month, February 2013, we focus on the new topic of online rating systems for doctors. Do parents use them? How much do they use them? And how do they fit them into the decision-making process when they're trying to find the right doctor for their children? For help on this topic, we turn to our colleague here at C.S. Mott Children's Hospital, Dr. David Hanauer, also a primary care pediatrician and an expert in information technology.
In this month's National Poll on Children's Health, we decided to look at what factors were driving parents' decisions about choosing a physician. More and more families are going online to find information about not only medical conditions, but about the doctors that they may be taking their children to. How parents decide to combine information they find online with other sources of information, such as from family and friends, may impact the quality of care that they may receive. In the poll, we asked parents what the most important factors were for selecting a doctor for their children. 92% said that their health insurance was the most important factor, whether the doctor accepted their health insurance. 65% rated the office location being convenient as being important. About half of all parents said that the doctor's years of experience was important, and also about half said that word of mouth, such as from family and friends, was important. 40% said that referral from another doctor would be important, and only 25% said that doctors' ratings on websites were important, the lowest of all of the different factors. One of the interesting things that we found in this poll was that mothers were more likely than fathers to go to online rating websites to select a doctor. Also, families with parents who were over 30 years old were less likely to look at online rating websites than those who are younger than 30 years old. This suggests that as new families are having children with younger parents, they are more likely to be using these websites. So over time, the use of these websites will keep increasing. One of the interesting things that we found in this poll was that only 5% of families had ever left a rating on a website. This suggests that others who are going to these websites to find out about a good doctor may not be getting an accurate picture of what is actually going on with these physicians. An important take-home message from this poll was that the ratings may not reflect the broad range of experiences that patients have actually had. These websites are not regulated, and therefore we don't actually know who is leaving these ratings at all, or how accurate they are, and therefore patients and families must really consider the validity and the accuracy of this information when making a decision based on what they find online.
What will happen in the future remains anyone's guess, but online rating systems seem to be part of that future.